So medial tibial stress syndrome, or better known as shin splints, is a common injury that we kind of see in the office, especially around this time of the year when summer's kicking up, it's getting a little warmer, people want to be a little bit more active, so they're out and about and they're running, as well as just this past week we had to finish up the Flying Pig, so a lot of marathoners are out there getting ready and getting training. So what is it? It's just mostly just an injury to kind of the anterior aspect of the shin, mostly a little closer, more towards the ankle. Realistically, it's just kind of small micro trauma, or it's just micro fractures to the shin. It's because when we increase the amount of load or stress on the joints or onto the bone or the muscles in the area, sometimes we just kind of overtrain or something along those lines that just puts too much stress on that area and creates this injury. So typically in the office, we do see people present with this condition, especially like I said, if they've been increasing their workout load, they've been running a lot more, this injury also kind of comes on a lot with people that do a lot of jumping as well. So you're going to start to see this kind of in the HIIT workouts if someone joins a new gym, or this is also very common in military members as well, because they're doing a lot of walking, they're doing a lot of ruck training, so all that excessive load on the bone will tend to create this problem. So in the office, how we will typically take a look at this patient or kind of work them up through an examination is we'll check the gait patterns. So we do want to see how you're walking and or how you're running. We want to kind of test the tissue. We want to see if there's a muscular imbalance with the muscles that may be kind of creating this problem. So we'll typically check the hips, we'll check the knees, the ankle joints. We'll just kind of make sure everything's moving like it should be, as well as we'll just make sure that the muscles are kind of balanced out. Because if you get, one muscle pulling harder than the other, then you're going to get a little bit of a shift in the biomechanics, and that will sometimes create this problem. So we would like to take a look at that first and foremost. And then typically as we get into treatment, a good bit of myofascial release will help. So we'll do a lot of soft tissue work. We'll utilize our Graston tools, or maybe some cupping, as well as possibly some acupuncture or dry needling that also will help as well. Now, once we kind of get the tissue deflamed, kind of get the muscles kind of moving and grooving like they should be, then we'll kind of work into the gym. So we'll like to incorporate exercises. We'll like to strengthen and stabilize that area, as well as, maybe change up your workout program a little bit into more so kind of some cross training. So if you're doing a lot of running, we might put you on a bike or might have you swim a little bit. Something to kind of keep up that endurance training, but it takes off the compressive load to that area. So once we're kind of gotten you into the office, like I said, gotten the muscles loosened up, got you into the gym to kind of strengthen and stabilize those muscles, then we'll tend to kind of release you back to your activity that you were doing. So if it's running, for example, we'll tend to kind of what we call ladder up. So we'll just kind of start light and then we'll kind of just work our way up back to that full mileage. And once you do that, you're just kind of easing the body and allowing the body to kind of adapt to the higher mileage. And that way we can kind of avoid this injury in the future. You're getting out and about now that the warmer weather's coming, you're out running, you're jumping a lot more with some new workout classes, something along those lines, and you're starting to kind of experience some front of the shin pain, we'd love to help. Give the office a call. We'd love to take a look at it, give you a nice little thorough examination, and kind of help you out in order to kind of fight this pain. So the office number is 513-463-3011. Call today and we'd be happy to help.